Are there special considerations for someone with dry eye undergoing blepharoplasty? Previously, I asked which procedures would be best in light of my severe dry eye. The doctors have responded that I should see an ophthalmologist for diagnosis. I was diagnosed with MGD, meibomian gland dysfunction. I have done as advised, including cauterizing my upper lid tear ducts, nightly hot compresses, followed with special gel, and Restasis twice daily. It is still dry but relatively comfortable. What would be the best way to get my upper lids lifted and the fat removed from under the eye? Thanks.
Thank you for your question. I am very happy to see that you have done a lot of your homework in order to ensure that the health of your eyes are properly maintained before you consider having eyelid surgery. As an oculofacial cosmetic surgeon, practicing for over 20 years with a lot of experience with dry eye and tear duct issues and lacrimal gland issues, a very common concern that people have after eyelid surgery is dry eye. And so the ideal way to deal with your situation is to ensure that your eyes are properly lubricated before the surgery and to have the surgery performed in a way that respects the anatomy and support of the eyes. One of the most common problems I see is malposition or retraction of the lower eyelid from cosmetic eyelid surgery performed particularly from the outside of the eyelid where an incision is made underneath the lashes. Now that doesn't mean that you can't have that procedure, but the proper procedure needs to respect the anatomy and support necessary to keep your lower eyelid in proper position. So essentially my approach is also to ensure that, to deal with the second most common thing that we see with people after cosmetic eyelid surgery who come for revision is difficulty with closure of the upper eyelids. Essentially what ends up happening is well-meaning doctors will take away a little more skin than the patient can tolerate such that their upper eyelid closure is compromised. And if you do any research on the web, you'll learn that it's more common than you would expect. So a strategy for you that I would suggest, considering looking just at your photos alone, would be a conservative reduction of the upper eyelid skin, artfully done. I always teach doctors who are learning how to do eyelid surgery that upper eyelid surgery does not require a very aggressive removal of skin. Younger looking eyes don't necessarily have the absence of a lot of skin in the upper eyelids. So it doesn't make sense to me that such aggressive removal of skin, such that it's difficult to close your eyes, is in any way indicated. So I would artfully reduce the skin in the upper eyelids so that the shape looks natural and essentially the excess skin related to genetics and aging is addressed. With your lower eyelids, you have some fat prolapse and you have a fair number of fine lines and wrinkles. So I would probably do a combination of a transconjunctival blepharoplasty, which means I would reduce the fat pockets from the inside of the eyelid. By doing that, I essentially maintain the natural support of the lower eyelid, and there are several muscles that have to be in balance, and we reduce the likelihood of the eyelids pulling down. Now this is a little more advanced technique, but it is very, in my opinion, a very respectful of the anatomy so that your function is preserved. To treat the fine lines and wrinkles, depending on the amount of skin you have, and that's one thing I can't assess by just your photo alone, is the elasticity of the skin, which I would feel. I would probably do some type of laser procedure to help improve the skin quality and tone under the eyes. I would still be conservative because the goal is not to be so aggressive that the skin gets so tight that it pulls the eyelid down. Another common reason for people to come and seek a specialist like myself. So I think your procedure can be done being mindful of proper eye lubrication and management, as well as continuing proper eye lubrication after the surgery. It's normal to have temporarily drier eyes after eyelid surgery, but I've operated on patients who have severe dry eye for cosmetic purposes, and uniformly patients have done well with proper management from an ophthalmic standpoint, as well as proper management from a surgical standpoint to ensure good function of the eyelids. So hopefully that was helpful for you, and thank you for your question.